Hello, everyone. I'm Jennifer Taylor, and I live and work in Calgary, Alberta. This is my final step in my MPH journey, so just 10 more minutes, and then we can all have a break. Yay. Exactly. My practicum was working with the Director of Public Health Calgary, and my project for her was to build a business case for centralized immunization bookings in the Calgary zone. There are obviously many options for a centralized booking model, but due to time constraints and the magnitude of the project as a whole, I focused on one option, a centralized booking model for immunizations with Public Health and HealthLink Alberta. What is public health? Just a brief definition for some in the room or who are listening who may not be in our program or in healthcare. Public health shares a common purpose with the larger healthcare system to improve quality of life, to support people in staying healthy and reduce premature death. And the emphasis in public health is improving the health of individuals and communities through programs and services that promote and protect health, prevent disease, disability, and injury. What is HealthLink Alberta? You heard me mention that I did my project in concert with this department. HealthLink Alberta is a province-wide program operated by Alberta Health Services. HealthLink provides clinical services, navigation services, and online content support. Access to non-urgent healthcare and telephone triage services are provided 24 hours a day, 7 days a week. There are two geographically located centers. One's located in Edmonton and the other is in Calgary. The services are provided by over 400 skilled registered nurses, information and referral specialists, tobacco cessation counselors, and central access agents. In today's world, people want easy and people want fast. As public health practitioners, we want to ensure people book their immunizations. Sometimes in our field, we need to step back and look at processes through the average person's eyes. With this project, I stepped back and did just that. What does it take to book an appointment? And who is our first point of contact when booking our immunizations? The current well-child immunization booking model for Calgary Zone has clients book on-site at their local community health centers or phone into a particular health center of their choice to make their appointment. In the current model, clients may find it difficult to find available immunization times. Due to staffing issues and budget constraints, this has resulted in health centers not having available appointment times for weeks or even months at this point. Although at time of booking, clients are provided with information relating to other health centers with shorter wait times, there's a subset of the population that do not like to go through the exercise of having to call multiple clinics to find an appointment. Health centers, frontline clerks, spend much of their time on the phones booking these immunization appointments, while their other clinic duties, such as attending to arriving and departing clients, still need to be attended to. The future state option of a centralized booking model may simplify the process for the public with one point of access, just one phone call, to make an immunization appointment anywhere in Calgary. Data from a phone tally in 2013 demonstrates that 400 calls a day are received in the Calgary zone to book immunization appointments. An additional 300 calls a day are received related to moving an existing appointment or canceling an appointment. Each call takes on average 5 minutes, depending on the client, and even longer if they require interpretive services. HealthLink and Public Health in Edmonton have been using a centralized booking model successfully for over 6 years. And although their situation differs somewhat, the HealthLink agent call time to book appointments is 2.5 minutes, and the client waits no more than 1.5 minutes in a phone queue. My objectives were to determine if HealthLink booking well-child clinic and routine adult immunization appointments in Calgary was a feasible option, to determine if this option could ease and improve bookings for the public, to determine risks and costs and operational impacts associated with this model. The first thing I did was a literature review. And I used many search terms and I searched many databases, but I only found 2 relevant articles. There were some that were somewhat close to this type of booking model. There was a lot of radiology and diagnostic services that used this type of system, but there was nothing that related to the complexity of booking an immunization appointment. We held informal stakeholder meetings, and we held these meetings about once a week to update issues and ideas, and they generated usually information that led me down other avenues, and I'd have to call other stakeholders, which wasn't my forte because I'm quite shy. But when I did that, I realized that when you're dealing with stakeholders, you really need to be prepared. You want to have your questions all laid out, and you also want to be prepared for their questions to you because nobody wants to waste time. The next thing I did was I reviewed AHS documents. And this was like looking for a needle in a haystack. There was a plethora of information available, but to narrow it down to my focus was not easy. Some data was not current, some data was not relevant, and so this took a lot of time and effort and was not my favorite part of the project. I read and read, but I needed to have a business case that aligned with Alberta Health Services' vision and missions. My methods included a project risk analysis and an informal cost analysis. The risk analysis was very interesting. I learned about staff and their concerns and where fear and pushback may come from. I also learned what some of the risks would be. What if the immunization scheduler system crashed? What if people went to the wrong health center? Not only did I have to identify all these risks, I had to work out a risk mitigation strategy for each one. The cost analysis was also something I had never done before, and this process was really in-depth, and because of that, I could not do a formal analysis, just no time and no budget for that process. So my work consisted of gathering numbers of an approximate ranges. It's very eye-opening to see how just one small project in public health can be so expensive, and how to factor those costs into a very limited overall budget is very, very stressful. Some of my findings were funding approval would need to be procured at the executive level, and this is expensive and a time-consuming process. Public Health would need to find funding for 7 full-time clerks to be agents within HealthLink Alberta. HealthLink would need to find suitable space to accommodate these agents, and funding related to upgrades like telephony, data closets, and furniture would need to be found as well. Training and change management costs would need to be incurred at both Public Health and HealthLink, and this becomes a time and capacity issue for already overloaded management and education staff. My recommendations that came out of this work are to develop similar reviews for other proposed options, including the status quo, so to build a business case model for each one of those, to submit a network process intake application to do a complete cost analysis of this option through the Alberta Health Services Finance Group. And if I was to do this project, that's the first thing I would do because it is very, very time consuming. To determine if the current scheduling software would need to be updated to allow for accommodations of extra agents, the potential capacity issues of that, especially if there is an outbreak like we've seen with measles and influenza. And if the option were chosen, then a pilot project would be an appropriate way to start this business case. In conclusion, a centralized booking model is viable in the sense that it will decant work from clerks to do more clinic-related tasks, and it will make booking appointments a smoother process for the public, thereby increasing client satisfaction. Although costly, the satisfaction and ease of booking for the public is paramount, and increased job satisfaction for the staff at the health centers is something that's worth noting. Working for 3 months with my practicum supervisor in public health was fascinating, and I'm thankful for the opportunity and experience. I'm extremely proud of the work we do and hope to continue in this field as it is growing and I believe the forefront of healthcare. For their help and encouragement and support, I would like to acknowledge the faculty and staff of the School of Public Health and Social Policy, Shelley Filley, Director of Operations, Public Health Calgary Zone, and Lara Osterreicher, Director of Operations, HealthLink Alberta. Thank you.
Thank you, Jennifer. I'm sure there must be comments and questions. I mean, a business case, my goodness. Come over here, and then I'll work my way back over.
Okay, mine is more of a comment, it's not a question. I was listening to CBC News this morning, and they were saying that school children are not up to their immunization because of that, because for those vaccines that necessitate 2 doses, the parents they don't want to go through the motions again of having to make an appointment for the second dose and stuff. So your project might be very useful.
Yes, that's right.
And it's very contextual, I guess.
Yes, that's right. Yeah, we haven't met our target immunization rates yet. So I know the plan is to 2017, and some of our targets are 97 or 99%, and some places we're only at 90 or 92. So making that second appointment should be easy.
Thanks so much, Jennifer. This is an issue that's very near and dear to my heart, as I have pulled my hair trying to get my children immunized in Victoria, and it's just as bad here. And for sometimes that second dose, they say, well, you know, she needs to get her booster in 3 months, but we can't actually give you an appointment for another 6. So see you then. And in my mind, I think like the centralized booking in the context of Alberta sounds nice. In Victoria, there's just one health unit that you go through, so there's no option to go to another health unit or try to shop around. So it's interesting because wouldn't even be an option in here. It is already kind of centralized. But there's 2 ideas that I have that could improve it, and I'd like to hear your thoughts. One is to return drop-in immunization clinics, which is something that was done here and was cut so that parents can come on their own schedule without an appointment. And the second one is pharmacists are able to do immunizations for people, and we saw that with flu vaccinations. But they're not, I understand it's the College of Pharmacists does not allow them to immunize children. So I think it would be huge if pharmacists were allowed to immunize children. There would be so many more service providers, and you wouldn't have the same waits. So the drop-in clinics, the pharmacists.
Right. I hear what you're saying. I can only speak from an Alberta perspective because that's where I work. The drop-in, I don't know if that would help. Even this model isn't going to really cut back on any times, although I would love to say that it would have that domino effect. When there's only so many staff and you still have that same amount of population, it really doesn't matter where you go, you're still going to be waiting. So I'm pretty sure even with drop-ins, you're going to still be waiting because there's only so many staff. So until we get budget for more staff, we can't really increase that. The pharmacists, I'm not sure, would have the training or the background knowledge or critical thinking in relation to that nursing sense in order to get a client history. And I mean, I know they're very educated on pharmacological things. It's sort of that whole nursing model that we do with the client when they come in. We do weights and measures, we do head circumference, we talk to the family, try to get a sense of where they're at. Is there any problems? Are there any abuse situations going on? So it's like a whole thing. It's not just an injection.
It was a really interesting presentation. On a side note, I think Saskatchewan pharmacists are actually starting to be delegated a little bit more in terms of immunizations. I'm not sure with children, but I know a friend of mine's a pharmacist and he's gaining more responsibility. I thought these are kind of some comments, I'm sorry, but it was really interesting in terms of practicality because so much of public health in an academic setting is the social determinants and stuff, but in practice, immunization takes up a huge amount of funding in reality. So it was really neat to see something that's extremely practical. And I was just AHS HealthLink, a fellow Albertan here, so that must have been a blast. I can think of lots of people who could use more work at HealthLink. That sounds mean. But what about transferability from Calgary to Edmonton? Since I know AHS is centralized, we don't have authorities.
Yes,
like in BC, was there any kind of
We are just one health authority for the whole province. So it makes it a lot easier because we all work together. So whether you're working in Edmonton or Calgary at HealthLink, it's provincial in scope. So what we do in Calgary, we do in Edmonton. So right now they are doing it in Edmonton, and they have been successfully for the last 6 years, but they have a bigger budget for it for some reason, and I'm not sure why. I can't remember the whole background to that, but Calgary didn't get the same amount of money in order to put that into place. Yeah.
We could have a week's discussion on this.
I know. It's a big one.
I'm a public health nurse here in VHA,
Okay.
and we'll have to talk. Anyway, what I was curious to hear was, not quite sure exactly how the system would work. Would a client phone into a central line, speak to whoever, and book an appointment at whatever office in the Calgary region?
That's correct.
Okay, and again, correct me if I'm wrong, but I'm sort of thinking, would it look at sort of timing as well as the geographic location of the particular health unit?
And capacity of the client in order to get themselves and their children there. Because some families don't have the money to put everybody in a car or a taxi or a bus.
Exactly. What we're doing here is we have a system where we can just transfer calls to another health unit. So somebody can phone into, say, the office that I work in, and if we can possibly, we ask them, can you go to another health unit? So here's the other health units, can you get there, sort of thing. Do that assessment, and then just transfer the call seamlessly. So I'm kind of trying to think, is that kind of how it would work with your system?
No, so
No,
that's
it's
an
a central-
option.
yeah.
So I just did one option, which would be a whole centralized
Right.
phone-in center, and they'll make that
Interesting.
appointment for
Interesting.
you. Yeah.
Yeah, lovely to compare notes. Thank you so much.
Yeah.
So I just would like to add my own comment, and that is obviously the processes of immunization have gotten more complicated because I just recall being herded out of my grammar school class into the lunchroom where we were lined up, punch, 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 okay, there's your polio immunization, done. Okay, thank you, Jennifer.
Thank you.
And
Thank you.
we're having a 15-minute health break, right? So we reconvene at 3:15.